One weird number is your vitamin D number. I've actually never seen a vitamin D level at 150. So what were you doing, Ben? Never seen a number that high. I mean, in the vast majority of people, this is the one number that always comes back low.
But I really feel like my nails are growing much thicker and quicker. I have to cut them every 3 days now.
Really? Okay. Yeah. Even on oral GHK?
Oral GHK, yeah.
Really?
On an empty stomach in the morning. Regarding my left knee, obviously I have no ACL, no lateral meniscus. So what is it doing?
There definitely is some regenerative potential of some of these products. It'll bring more blood vessels into the area, bring more collagen. At least it's, keeping the inflammation down, creating a very favorable environment in that joint for no further degeneration to take place. But yes, I do believe that there is some regeneration going on at a cellular level.
Welcome to Optimal with Ben Bowers. Joining us is none other than Dr. Jonathann Kuo, a beacon of expertise in the fields of interventional orthopedics, regenerative, and anti-aging medicine. With 2 board certifications, Dr. Kuo's dedication to longevity touches every aspect of his work. Kuo's exploration of peptides, stem cells, gene therapy, and beyond pushes the boundaries of what's possible in modern medicine. His pioneering spirit extends to interventional mental health, where he uses innovative techniques to alleviate mental health conditions with compassion and precision. In this interview, we break down the versatility of peptides and recommend the best supplements for anti-aging and tissue repair. We also navigate the complexities of modern healthcare while utilizing a holistic approach and get into controversial topics like whether or not therapies like testosterone replacement and ketamine are safe and effective. Behind every achievement is a story, and Dr. Kuo's journey with Hudson Health speaks volumes. Having served over 50,000 patients in the heart of New York City in over 15 years, his reputation is truly profound. So without further ado, Dr. Jonathann Kuo.
Quite a pleasure to be here, Ben.
Thank you.
I'm super excited to chat with you.
I've had several friends come to you with incredible experiences. My buddy Tolga came to you and he was suffering from this chronic stress and sympathetic system, and then you gave him an injection and he told me it completely went away within 24 hours. Can you explain a little bit about what that was?
Yes. What I did for Tolga was a sympathetic nerve block. So that was a reset of the sympathetic nervous system. He was having a lot of issues with stress and kind of numbness and tingling over his head that coincided with periods of feeling a little overwhelmed and stressed. So, we diagnosed him with a sympathetic overactivity syndrome. And so the block of local anesthetic at the stellate ganglion at C6, I think really helped to just eliminate his symptoms. So we got that one.
How often do you inject New Yorkers?
That's actually one of the primary things I do.
Yeah.
So I do a lot of these blocks as one of the main treatments that I offer. It is very useful for stress, for anxiety, for PTSD especially. Originally, it was developed for chronic pain syndromes of the upper extremity and used by anesthesiologists to do that. But as time, especially over the past few years, we've figured out that has been really helpful for people with an overactive sympathetic nervous system or an overactive fight or flight response, which we see in people these days that are, unbalanced and stressed out with modern life.
What else have you seen? What other interesting procedures have you done on your 50,000 patients?
So my career started off in pain management, just, treating people with chronic pain. And so, I learned a lot throughout that process. It was, treating just degenerative spinal conditions, degenerative joint conditions. And then, over a period of time, you kind of realize that, some of these treatments, yes, they can help with pain, but that doesn't really necessarily fix the root cause of why some of these things are going on. So, it was always in my interest to dive a little deeper and kind of get to the root cause of why people suffer from degeneration and breakdown. And so that kind of led, really naturally to the realms of regenerative medicine, anti-aging, and just the basic concepts of cellular medicine and optimizing the basic hormonal and cellular physiological processes of the body. Yeah.
And one of your core regenerative practices is peptides.
Correct.
And stem cells. But let's start with peptides, because that's one of my favorites.
Yes, one of my favorite topics as well.
I have an interesting story regarding peptides. I was in Aspen at Ajax on the Moguls, and I tore my ACL and lateral meniscus. Okay. And I skied down on one leg, went to the hospital, and they said, we have the best knee surgeons in the country. You tore your ACL and meniscus. I had an MRI. And I was like, yeah, well, before I get surgery here, I want to go back to New York City and go to hospital sets of surgery where they have the best surgeons in the world. Yeah. And I come back and they're like, yeah, you really need surgery. And then COVID hit, went to LA, and there's nothing I could do. I couldn't go get surgery during COVID. So I did a lot of research online, and I ordered TB500. I ordered BPT 157 and TB500. And TB500 intramuscularly into my left quad near my ACL was magic. I was able to race 2 half Ironmans since then, and I haven't had any issues in like 4 years. So I'm back on the cycle of TB500 intramuscularly into my left quad. I'm on thymosin alpha 1, which is an immunomodulator, right? And it increases your immunity cells into sub-Q. And cerebrolysin as well, which is a 1 ml 5 days a week, 2 injections into both legs.
Okay.
Tell me about your experience with TB500, BBC 157, thymosin alpha 1, and cerebrolysin.
That's a great protocol you're on. And, every day I hear stories of success like that. I've been working with peptides for several years now, have, had hundreds of clients on these medications, and I can say without a doubt that they really do work, and in medicine, it's very hard to find something that works at the same time, having really minimal in terms of side effects. So, in my opinion, these are really a fascinating class of medications that are not necessarily medications. They're kind of like fall between the supplements and medications, kind of almost like in between. I love working with them. The peptides you're on are great. Some of my favorites and some of the standards. Just to go into like what peptides are and their kind of mechanisms of action. Peptides are short chains of amino acids, the building blocks of proteins, and in simple terms, you can think of them as small pieces of a larger puzzle where the puzzle is the protein. And so these peptides play various roles in the human body, acting like little messengers or tools. And so our body naturally produces around 7,000 different kinds of these little messengers in a complex orchestra to ensure all of our systems are functioning properly. And so as we age, though, however, we naturally produce less and less of some of these substances. And by specifically adding back some of these little messengers, we can really augment and improve our body's function. So the mechanism of action of peptides can vary greatly depending on what the type of peptides and their specific function. And some of the simplified examples are, one is a signaling peptide. So some peptides act as signals in the body, and they bind to receptors on the surface of the cell, much like a key fits into a lock. And then when they bind to these receptors, they send a signal into the cell telling it to do something, like to grow or divide or to release other substances. So the growth hormone secretagogues kind of work in this fashion. Okay, they bind to receptor sites on the anterior pituitary and ask your body to produce a little more growth hormone. So those are kind of some of my favorite peptides.
Ipamorelin, ceramorelin.
Correct. Ipamorelin,
growth hormone secretagogues, right?
Yep. Testosterone, things like that. So definitely seen, great results with those.
Which you put my friend who tore his shoulder.
Yes.
Climbing a mountain in Nepal on Roski.
Yes, Roski.
And he's he's on that. And he's also on TB500 and PPC 157.
Correct. And
he's really excited about what this regenerative medicine is doing for him. So
great. Yeah. BPC 157 and TB500 are synergistic in their anti-inflammatory. They boost collagen levels. They help promote new vessel regrowth. And so, that combination, that trio combination, I think is really effective for injury and recovery.
What are your thoughts on GHKCU? I'm taking it 4 milligrams orally every day.
Okay.
And I also have a topical that I have to mix with glycerin, vegetable glycerin.
Okay. Yeah. Right. You're doing the DIY way.
DIY, yeah.
Okay.
Right.
I've heard that.
But I really feel like my nails are growing much thicker and quicker. I have to cut them every 3 days now.
Really? Okay. Yeah. Even on oral GHK?
Oral GHKCU, okay. Yeah.
Really?
On an empty stomach in the morning.
Okay. Interesting. Yeah. I find like not a lot of people take GHK via the oral route, I almost suggest all peptides be done injectable form, okay? Other than some BPC, KPB, combinations that are very specific for like gut-related conditions. Those you can take via oral form, but most peptides generally work better in injectable form. If you're getting results from just oral, that's good. GHK I love, it's really good for collagen repair, collagen formation, makes tissues denser and thicker. It helps definitely with hair, skin, nails. There's a specific GHK cream that I like a lot that's compounded by a pharmacy that has GHK-Cu, KPV, which is anti-inflammatory, with a combination of like ascorbic acid, vitamin C. I use that cream a lot myself.
It's a facial cream?
It's a facial cream, yeah. But you could also use it on like scars and other areas like that too. So,
what do you think of combining this with like microneedling or Fraxel or laser genesis?
Definitely. Some people get, either stem cell facials or PRP facials, exosome facials. I often prescribe them that GHK cream to put on. It just helps with recovery, really. Yeah. GHK is a small little peptide molecule that can penetrate topically. One of the few peptides that actually work topically.
What are exosomes? What's the difference between umbilical cord stem cells, placenta stem cells, bone marrow stem cells, and fat adipose stem cells? And I know you've traveled the whole world extensively to experience all of them. So in your experience, what are the best? What have you seen anecdotally? And what does the research say?
Okay. Yeah. This whole anti-aging thing is a personal passion of mine. And, I've gone down the rabbit hole quite deep. I've gone to all the kind of leading laboratories in Panama and Costa Rica where you can get all these treatments done. And I've, toured their labs, kind of spoken to their medical directors, kind of understanding their science and where they get their cells from, the passages, the kind of cells and this and that. The IV infusions of stem cells there, I definitely think have a place in medicine. I do feel like they work. They can, reduce inflammation throughout the body. They can modulate your immune system. They can turn a pro-inflammatory state into a much more regulated, less inflammatory state over time. So I've gotten those therapies several times myself. What are exosomes and what can you get here in the U.S. versus outside the country? Here in the U.S. you can actually get exosomes, which is still considered a gray area in medicine, but stem cell MSC exosomes you can get here in the U.S. and we've been using that for several years now with actually pretty good results. Okay, and so these exosomes are kind of little vesicles, so little bubbles of messaging signals, similar to what peptides are. Like they're messaging signals. So, when you culture them, basically take off the growth factors that cells secrete. That's what an exosome is. So the little signaling molecules that can be injected in various places or kind of given through an IV infusion. And we've seen that these can provide a whole host of anti-inflammatory, regenerative effects, promote, new blood vessel formation, collagen formation. It's just one of the other techniques that we use in the regen medicine space. So, what is the difference between exosomes and some of these cellular products that we use? So, traditionally in regen medicine, you would harvest bone marrow stem cells or adipose-based stem cells from your fat or your bone marrow. And those can be quite effective, but, those are invasive procedures to get those cells. And I would say after age 45, 50, like sometimes the quality of your own stem cells is actually not that great. Okay. And so more and more these days, I see better results when we actually go and get, either placental matrix or, Wharton's jelly from a lab, combine those with exosomes, combine those with peptides, and then you're getting a whole milieu of growth factors that then we just inject very specifically under ultrasound or x-ray guidance into specific areas of the body. And we've found that has worked pretty well without having to actually extract your own tissues. Although, the studies are still pending. Okay. There's a good amount of literature on, adipose and bone marrow derived stem cells. Because of the regulatory environment here in the U.S., there's not as much literature on the efficacy of exosomes and placental matrix, because you just need INDs to do that kind of work. We were the first practice to actually do an IND-based study for using exosomes in the cervical and lumbar epidural space to treat nerve pain, so treat, sciatica of the, we did a trial for that, injecting exosomes in the epidural space. on 20 patients. This was like 3 or 4 years ago, and we actually found, pretty statistically significant improvements after that treatment. Yeah. So yeah, these days it's one of the things I use quite frequently.
What are the like crazy stories do you have? Like I have lower back pain almost all the time. So I'm always doing like cross-functional movements and yoga because I like long flights or just sitting down for a long time, I have to get up and my lower back is just always in pain. So what would, if I went to Hudson Wellness, what would you help me with? Yeah,
I mean, first thing is biomechanical assessment, kind of taking a look at the MRI really closely. If this is a disc problem, like whether it's a disc problem, a facet problem, whether it's the nerve roots being squeezed, and then kind of devising a treatment plan around that. So these days, I would say, one of the options is it could be placental matrix and exosomes and peptides directly in the facet joints. Sometimes we inject the discs themselves. So, injecting the discs, flushing out the epidural space, the nerve roots with that kind of mixture, we found that kind of can give pretty significant results. The disc injections are really quite interesting because I've had, multiple cases where that's, quote unquote, fixed some people that have been in chronic pain for a very long time.
And regarding my left knee, obviously I have no ACL, no lateral meniscus. So what is it doing exactly? Is it strengthening the ligaments and the joints around the knee and stabilizing it? So I don't have any issues or pain there, or what is it? What do you think it's doing?
There definitely is some regenerative potential of some of these products, as in the growth factors in there. They can stimulate the cells in the area to kind of try to regrow some of the reparative process and to, bring more blood vessels into the area, bring more collagen. Some of these ligaments are avascular, okay? Like as in they don't have a blood supply. It's hard to really say that, oh, hey, we're regrowing an ACL by injecting kind of, exosomes and placental matrix. So I wouldn't go so far as to saying that, okay? At the very least, it's, keeping the inflammation down, creating a very favorable environment in that joint, in that area for no further degeneration to take place. But yes, I do believe that there is some regeneration going on at a cellular level. Yeah.
What is rapamycin? What is mTOR? What is AMPK pathway? Catabolic, anabolic?
Yeah, I mean, rapamycin is an mTOR inhibitor. Okay, and we know that mTOR inhibition is one of the things that can, drive a lot of pathways related to inflammation and aging. Even, mTOR is indicated in like a whole various types of like neurocognitive behavioral aspects and things like that. There's a really great podcast with Peter Attia and Matt Kaberlin and David Sabatini. I'm sure you've heard of that podcast before. mTOR inhibition is it downregulates a lot of the cellular pathways that are associated with aging and the hallmarks of aging. So, I would say at this point, I believe that there's enough data out there to support the use of rapamycin. I, do that myself and do recommend that to clients. 6 milligrams once a week is, I believe, a good kind of dosage to start. I usually do 1 milligram every 10 kilos kind of thing. Sometimes you do have to like monitor white blood cell levels. Some physicians do that. In my instances, like I've never really seen anyone have elevated white counts because of that. Side effects can sometimes include like getting canker sores and things like that. But otherwise, I really find it a pretty harmless medication unless you were like already immunosuppressed or something like that. Then I'd be careful taking the medication. But there's like more and more studies coming out. There's a study on like people taking rapamycin who contracted COVID-19, and like the people that were on rapamycin actually had like less symptoms over time. mTOR also helps with like autophagy, reduction of inflammation, the turnover of senescent cells in the body. And so, medications and things that can inhibit mTOR are one of the mainstays of longevity treatments these days.
Are there any peptides for like senolytic peptides for autophagy, boosting autophagy?
You can boost kind of cellular turnover a little bit with some of the growth hormone secretagogues. I wouldn't say that there's a specific peptide for that. There are medications for that, like quercetin, dasatinib, fisetin. Those are
spermidine.
Yeah. Some of our classic senolytics. So yes,
there's a lot of spermidine in natto, actually, which I put in my smoothie every day.
Yes, there is. Yes.
So regarding like peptides, what are your favorite nootropic peptides? So I told you I'm on cerebrolysine, but it's not really a peptide, right?
Correct. Yeah. Cerebrolysine is, it's kind of hard to describe that. It's like a bovine pig derived protein that helps like stimulate BDNF and things like that.
Brain derived neurotropic factor.
I like cerebrolysine a lot. I've used it in people with like neurological disease and strokes and things like that. But I also use it in healthy individuals to kind of boost brain function. I like that in combination with like NAD, methylene blue. I sometimes do a little cocktail of methylene blue, NAD, and cerebrolysine. That's kind of like one of my favorite little IV pick-me-ups that I do. Cerebrolysine can also be helpful for pain, actually. So, in trigger points, we kind of do, 5 mLs of cerebrolysine in people that have pain in specific areas, and we find that quite helpful as well. So that's an interesting one. I like that as a nootropic. Some of my other favorite ones, C-Lank and C-Max, probably, those can be done as nasal sprays. We do see a lot of mental health patients in our clinic, and, I do inject C-Lank and C-Max directly by the vagus nerve at times too. So I've done that as part of my whole bio-reboot process by the vagus nerve and the stellate ganglion. I've seen kind of results with that. I like that combo. It doesn't work for everyone. P2228 is another one that I like. That's a good anti-anxiety anxiolytic. Some people kind of respond well to that. Synapsin RG3 is another one. Everyone's brain chemistry is a little different. You kind of have to try a bunch of these things out to kind of see which ones work for you.
Is there a way to test your genome first? Like I had my genome sequenced and I'm able to see certain things. Like I have a genome snip that says I'm pre-psychosis to THC, and I have a genome that says I don't make enough for my mother and my father. That I don't make enough choline, or I don't produce enough glutathione. So I take liposomal glutathione and phosphatidylcholine 5 days a week.
Yes.
Is there a way to see that before, or test your genome before?
Yes, you can. I mean, your example is one that makes sense. Yes. So, I mean, I some of this, I don't think there's anything that can predict your response to C-Lank and C-Max that I know so far, so some of the things that you can't, but, if you're like deficient in choline and things like that, there are obviously ways to boost that with, phosphatidylcholine, phosphatidylserine, things like that. I
have a lot of friends who are scared to who try psychedelics, although they have anxiety, they have, trauma from when they were a child or whatever, and they're scared because their parents, one of their mother or their father has like schizophrenia or their psychosis. So my genome sequence told me to try pregnenolone, which I take 200 milligrams every morning, which is actually a nootropic as well. And I haven't had any psychosis outbreaks since I've done it. I've experimented quite a bit.
Okay. Did you used to before you took pregnenolone? Really?
Yeah.
Okay.
Quite a lot.
Okay. Great. Hey, listen, I mean, genetic testing is, definitely on the frontier of medicine. Like there's quite a few companies out there that do that now. And, I think it's very important to get that baseline. And, I'm doing that more and more on our patients as well. But
before they do under the ketamine therapy, intravenous ketamine therapy.
Yeah. That's not something that we do standard. No, it's not something we do standardly, but, if people want to know a little bit more about, how they respond, their biology and physiology respond, then I think that's a very important thing to do. Yeah. Yeah. Which genetics testing do you do?
It was a college from Toronto. It was like 3 years ago. And then recently I was able to pull out my 23andMe data, download it, and then upload it to Dr. Anna Patrick's website. And it gave me my whole comprehensive genome report. It gave me my telomere report, my macronutrient report.
Okay.
And I did that for me, my current girlfriend, and my ex as well.
Okay.
And,
I love it.
It's quite interesting. Hey everyone, I just want to interrupt for one moment and ask for your input. We're striving to make this channel even better and more valuable for all of you. So if you have any constructive feedback, suggestions, or questions I may have missed, please don't hesitate to share them below. Also, if you enjoyed this episode, please leave a review on whatever platform you stream the podcast. We really appreciate this because we have a goal of hitting 50 reviews by the end of the month. Your contribution won't go unnoticed. Thank you for listening, and now back to the interview.
should we go over some of your lab work?
Yeah, please.
Okay.
I see. Yeah, my test has gone down, but I still feel great.
Still feel great.
Because it's my free testosterone is my free testosterone fine compared to my total test?
Yes. I mean, the ratio is one thing. The free test is kind of what I look at a little more these days, because that's kind of what the bioavailable test is. I mean, your previous result was 168, so this came down to 103.7, which is something that we definitely want to like watch and monitor. Testosterone is one of these things where you don't just treat a number. You basically really look at whether someone's exhibiting any symptoms, and so in all categories, these numbers are still well within what I consider a really, healthy range. And if you're not symptomatic, if you're telling me you're feeling great, then, that's just something that we should watch and probably repeat these labs in like 3 or 4 months to see,
I was on enclomiphene before.
You were? Okay.
I've been off for about 3-4 months.
Okay. Okay. That could explain some of these results.
Yeah, because I had a urine analysis test done where I had to pee in a cup for every 8 hours for like 3 days. And it showed me that I metabolized testosterone into the bad estrogen.
Okay. Yeah.
And so I went on enclomiphene and it boosted my test quite a bit.
Great. Great. Yeah. That's one of our basic strategies for boosting test. Yeah.
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 Without going on exogenous testosterone.
Correct. Yeah. We're seeing so many instances of young men these days having really low and plummeting T levels. Either that's related to like stress and anxiety or a lot of environmental factors. I think it's almost like a epidemic throughout the entire country. So it's one of the things that we're seeing more and more of. So yeah, but yes, as you mentioned, like enclomiphene is a good way to kind of, a starter way to kind of boost that. And then there's the whole realm of testosterone replacement goes kind of deep, but some men, they really actually do need, to inject testosterone to feel normal. And, I'm seeing that more and more in men as young as like 35, 40. Yeah. But, once again, it's like really depending on how you feel. But a lot of men actually don't even realize, you don't really know how you feel on a high T level with high testosterone until you actually get to that level. Okay. And so, and some guys who see me with like, they say they're feeling fine, but there's like, hey, somewhat low energy, a little less libido and this and that. You give them a shot of 100 milligrams of testosterone, like they're like, wow, I feel so much better. In those cases, they might be candidates for, TRT in injectable form, because that's kind of the most reliable way to get testosterone in your system. That obviously comes with some downsides, because that does kind of shut down your endogenous production of testosterone. And people with men that want to have children, that's a problem, because it actually shuts down your sperm production as well. So, there's various kind of strategies to go around that. You can take enclomiphene, or you can do HCG, right? HCG to prevent, to continue to stimulate your testes to produce testosterone.
Right.
But
gotta be careful if you're on HCG though. Get your girl pregnant quick.
That's right. But in men that want to preserve fertility, but also be on T, like there's a way to do that. And I find that T replacement in some people really makes a tremendous difference. Yeah.
What about peptides besides exogenous testosterone that can increase T levels? And like IGF-1 peptides, or I think one of the more common ones, like kisspeptin. Okay, kisspeptin is one that can increase your T levels, stimulating your LH-FSH pathways. That one is one. In my clinical experience, I don't find that works super well. The growth hormone boosting peptides can boost T levels. I found that. I would say that those are the kind of main ways. And then just honestly lifting lots of weights, lifting weights, having more sex, like that increases your T levels. Having less body fat, so your T kind of stays in your system without being kind of converted and aromatized into estrogen. Staying lean, staying fit,
those can kind of all increase your T levels.
Yeah, no, I feel a huge difference on every Monday when I do hex bar deadlifts, 5 reps, 5 sets, max weight.
There you go.
I just feel it. I'm firing on all cylinders.
Firing in your head.
And then let's look at
the other labs. I mean, there's like little things to point out here, like your hemoglobin A1C is in a really nice and healthy level. That's one of the most important markers I look at these days because that's a
what is that?
That's a 90-day average of how well you've controlled your blood sugars, and so in these cases, like we really try to keep that like low 5s and even under 5 for kind of looking forward. That's your glycemic control. So that number looks pretty good. Your LH is actually quite high. It used to be 11.3 and now it's 9.0. I mean, being on enclomiphene in the past could also explain that high number. If you're even off enclomiphene, you're at 9, which is, that's LH is directly stimulating those, Sertoli cells in your testes to produce testosterone. So that's a nice, healthy number. Your estrogen levels look kind of nice and low. That's good. Your IGF-1 is within range. Those look good. One weird number is your vitamin D number. I've actually never seen a vitamin D level at 150. So what were you doing, Ben?
Yeah, previous to 61. Liposomal vitamin D from Quicksilver Scientific.
Okay. I've never seen a number that high. I mean, in the vast majority of people, this is the one number that always comes back low.
Well, I felt like I was sick coming from Carneiros, Carneiros, Brazil for New Year's. And I was just liposomal, glutathione, liposomal vitamin D, molecular hydrogen drops. I was pumping it all into my system to get better. So maybe that explains it.
Okay. Probably back off on the liposomal vitamin D for a little bit here. Recheck that number in like 3 months again, because that really is a quite.
One thing I'm worried about is like plaque buildup around my endothelial glands and saturated fat. So I'm switching from saturated fat to poly and monounsaturated fats.
Okay.
Should I be worried about ApoB? It's kind of a hot topic right now.
Yes. That was one of the next things I was going to discuss. I mean, your ApoB is 96, right? 96, which is it's higher than optimal. All right. So, desirable optimal, I'd say, is like under 90. It used to be 91, it's 96 now. ApoB is a nice like marker of overall kind of, it aggregates a lot of the low density lipoproteins and aggregates it into one number that's, I would say, more indicative of cardiac risk than anything else. If you also have a snippet that is, that you're prone to kind of early atherosclerotic disease, then that is something that I would actually take a close eye on. Okay. And so
the Clearly test is the best way.
Yes. I mean, the Clearly test is definitely one thing that, you could potentially do. You are quite young to do that right now. It's not something I would like, emphasize heavily that you do right at this moment. There's one thing about like higher numbers, like high cholesterol and high ApoB numbers. The other thing is, what is that actually doing to your arteries? If in a few years you get a Clearly scan and it's totally normal, then, perhaps this kind of circulating levels of ApoB is not really depositing plaque in your system. And in those cases, you don't need to be as aggressive about that number. 96 is kind of like on the borderline of, what I treat. If you were 40 years old, I'd say, go get a Clearly test, see what that shows. If that's like totally clean, then I would just say, hey, let's just watch that for a little while longer. Okay. And just like, see what that, and see where that trends over time. Some people are a little more aggressive, and, there's like all these like, the PSCK9 inhibitors these days, like Repatha and Praluent. They're like super effective.
What are those?
They're PSCK9 inhibitors, which is, they basically prevent LDL turnover. They increase LDL turnover in the liver. And so it's like one of these injections, like there's ones that you do every 2 weeks. There's one that you do like once every 6 months, but they can like dramatically drop these numbers by like 50%, really quite rapidly. So, another of these, I would say, miracles of modern science. Actually, I have a familial kind of high cholesterol situation myself, and my ApoB numbers were in the 120s. And so, me, myself, I'm on some of these PCSK9s, and, my numbers are half of what they used to be. Not taking any statins and this and that, watching my diet, but not as careful as I like to be. But, my numbers look great, and my clearly scan was clear. So, I feel good about that.
Right.
Your case, I would probably just watch these numbers, do the dietary modifications and things like that. Increase your intake of healthy fats. And, I wouldn't necessarily do anything too aggressive about that number right now. Yeah. Cool. In terms of cardiac risk factors, I'd rank you as low. Okay. Yeah. Nothing too much to worry about there. Creatinine numbers is something that, they trended out here a little bit. It looks like your kind of kidney clearance and numbers have been kind of improving a little bit over time since you tested quite high. 1.39 is actually high. Okay. Back in January of 2022. That's definitely a high number. It's kind of trending downwards since then. I don't know what happened during that period of time for you to kind of decrease your renal clearance, or some kind of kidney issue or kidney insult at that period of time in 2022. But the numbers look like they're kind of coming down a little bit. And,
so that's kidney clearance.
That's kidney clearance. Okay. Yeah. The clearance of urea from your system is what that number looks at. And so, yeah.
2022. I think that was me going from athletic performance to longevity performance. I was training triathlon. Okay. So
if you were having ingesting a ton of protein and having a ton of protein breakdown,
fast sugars, glucose, fructose, sucrose, to push 450 watts on the bike for a minute and a half every 3 days. Yeah.
Okay. That could explain some of that. That could explain some of that.
What are you excited in the next 5 to 10 years in the regenerative and longevity space? What do you see?
I'm excited about all the new technology that's coming out. I'm excited about all the new research that's coming out. I'm on group chats with, longevity doctors from all around the world. And, every day there's a new test or a new way to look at things, new diagnostics, new treatments. Aging is such a complex phenomenon that it is, has to be tackled from just so many different kind of angles. I feel like we're making a lot of headway. The peptides and the ozone and plasmapheresis, and hyperbaric chambers, and, all these things, I feel like they actually do work. They really do work. And so, people that are proactive and on top of these things, I feel like you can really, significantly expand your health span over the next decades and things like that. So I think we're going to be seeing a lot more advances, and I'm very excited about that. I'm excited to kind of grow our practice and kind of offer a lot of these newer therapeutics. I'm excited to kind of put these things all together into packages and really be able to track someone longitudinally with the correct biomarkers. The medicine that we have is getting better and better. The advances in gene therapy are very exciting. There's a Follistatin gene therapy now these days that we've seen kind of really tremendous results on. It's a circular strand of DNA that you can just, inject into yourself. And what this does is it continuously produces something called follistatin. Okay? Follistatin. Yeah. Follistatin is, you can just think of it as a peptide. All right. Follistatin, in short, can just improve muscle growth and build. And so follistatin.
So is that pressing down on mTOR?
It's a different pathway. Yeah. Okay. Follistatin inhibits myostatin, which inhibits muscle growth. And so when you inhibit myostatin, you basically get more muscle growth. Okay. So it is a method where you can just gain a lot of lean muscle. Okay. Which is, one of the fundamentals of longevity and aging. And
is it intravenous, sub-Q?
It's a sub-Q injection that lasts for 2 years. It's a little circular strand of DNA. It's got a DNA plasmid. And it does not integrate with your own DNA. It kind of stays in the cell, but, has an instruction for, messenger RNA to come and just make this little peptide constantly. And so this kind of therapy is very exciting.
Wow,
so you can think like all these peptides that we're using right now, like is there a way that in the future we just encode some of these instructions on a little circle of DNA and just inject that and not have to shoot ourselves up five times a week? Like, that's really exciting, right? That's really exciting. So,
and what's the protocol on the Follistatin? Is it once a week or once a day?
No, it's once every 2 years.
Once every 2 years?
Yeah. Yeah, it's one shot that lasts for 2 years. Yeah. Yeah.
I'm a huge fan of Dr. Sabatini, his work on rapamycin.
Yeah.
I take 6 milligrams every Saturday, 36 hours after neuromuscular stimulation workout, and 36 hours before. So that's Friday to Monday. So Saturday night. And I just switched from capsule to a hard pill because it's apparently more bioavailable. And what's the way to test if it's working, rapamycin? What's like the biomarker to test it? Is there a way to test it?
You can actually get a sirolimus blood test. Yeah, you can actually do that. And I mean, actually, I think you tested for that.
Oh, I did, yeah.
Although when you're taking it in pulsatile fashion, like 6 milligrams once a week, it's going to be, a little harder to detect that. And, there's really I wouldn't say that there's really a biomarker to see, whether that's actually being efficacious or not. It acts as a immunosuppressant. I think your dosage is
25 low.
Yeah.
I think I was off of it for, like a week or two. Because I was traveling and then, and I just had but I'm going to get back on it. So I just want to get into mental health for a bit.
Yes.
And I've had 2 friends that have gone to you.
Okay.
They've done intravenous ketamine therapy with you.
Great.
And they've both 24 hours to 48 hours after ketamine therapy, you want to talk to your therapist.
Yes.
I haven't done it yet, but I would love to. So can we have some stories or some what you're excited about in that space and what it's doing in our brains? Is it neuroplasticity?
Yeah. So IV ketamine is, it's a BDNF, stimulant. So it helps with neuroplasticity. It helps with forming new thought processes. It helps reorganize some of the neurons, kind of helping you think in newer ways, promotes lateral thinking. And in itself, it's like, it's a psychedelic experience. It kind of allows you to step outside your default mode network, step outside the normal ways and patterns of thinking that are kind of ingrained in kind of your neuronal circuitry over time. So, for most people, it's your kind of that first kind of, out of body experience. And that can be a pretty profound experience from a psychological perspective. What I kind of say is, allows your kind of subconscious to kind of be more active, and you get to explore your subconscious and the kind of thoughts and ideas that kind of hang around there.
What's the preparation into going into this? Should you have a journeyman? Should you have your psychiatrist there? Should you do some work before with your psychiatrist before?
Yes, I mean, if you're actively seeing a therapist, I would inform them and kind of do some prep work into before doing a session. I mean, I think setting an intention sometimes is useful. But in certain cases, in many cases, actually, people just go in it and, see what the experience takes them. Right. And I think it's afterwards that's important to kind of like digest and download and think and integrate and write things down and talk to loved ones, talk to therapists. And so that is an integral part of the experience. People that have a lot of experience with IV ketamine, some people can, do that themselves. But, for a first timer, for the first kind of more, to really get the maximum effects, I would, try to talk to someone before and after. Yeah. The ketamine, sometimes we combine with that sympathetic nerve block, and we call that the whole bio reboot. And so
the what reboot?
It's called the bio reboot. A bio reboot is when we combine a stellate ganglion vagus nerve injection with a ketamine infusion followed afterwards. So that experience can, help with a lot of anxiety, stress, but also improve the mood, all at the same time. So that's something that we perform commonly at Hudson. Yeah.
And the research shows...
The research on ketamine is pretty substantial at this point for being helpful in mood disorders.
Disorders?
Yeah, for mood disorders specifically, I would say specifically depression. So, we have a whole mental health division and a psychiatrist, and a lot of our ketamines are done for depression, both clinical and subclinical depression. We also use for chronic pain. So in chronic pain world, ketamine doses can go quite high. And the mechanism of action is also just the same. It blocks the NMDA receptors and improves the BDNF in the brain, and it can help with that as well. So, there's, I would say, a good body of literature. Ketamine is one of the most rapid acting and strongest antidepressants out there these days. Some of these interventional mental health therapies can, get people off of some of these, antidepressants that the pharma industry tries to push on people for a whole lifetime.
That's exciting. Yeah.
Yeah.
I'm definitely coming to see you soon. I also need to come and do a new DEXA scan. It's been 4 months since I've done my last DEXA scan with you.
Okay.
For the bone mineral densities and the fat, but I'm not less worried about the fat. I want to slowly increase my bone mineral density.
Okay.
From those compound
vitamin
movements.
D of 150, You're building bone quick.
Yeah. I'm still puzzled by that. I need to go back to my notes and see why it's 150.
Yeah.
Well, thank you.
This was a pleasure.
Yeah.
Yeah. Great chatting. And,
you're a rock star.
Love to be a partner in your health journey. You're already on the cutting edge of things.
Appreciate you.
Great chatting, man.
In this interview, we dove into innovative and groundbreaking approaches to healthcare and wellness. Dr. Jonathann Kuo explains the use of sympathetic nerve blocks for stress, anxiety, and PTSD, how stellate ganglion vagus nerve injections can effectively target stress and anxiety, offering a potential solution for those seeking relief from these conditions. Kuo underscores the versatility of peptides, citing TB500, BPC157 for cell signaling, and recommending peptides for anti-aging and tissue repair, presenting a promising avenue to regenerating ligaments. Exploring topics like pain management and ketamine therapy, we uncover new insights into mental health and holistic approaches to wellness. Kuo mentions the research on ketamine is promising both as an antidepressant and combating chronic pain. As it blocks the NMDA receptors, it also boosts brain-derived neurotrophic factor, which increases neuroplasticity and helps us think in newer ways. He emphasizes the importance of integration and intention setting, journaling, and speaking with your therapist and loved ones post-ketamine therapy. As we navigate the complexities of modern healthcare, it's clear that a holistic approach encompassing innovative treatments and personalized care holds the key to a healthier and more vibrant future. Thank you for watching. For more information and to stay updated on the latest developments in healthcare and wellness, be sure to subscribe to our channel. Thanks for making this possible.